Welcome, everyone. My name is Dr. Todd Riddle. I am the Director of Education for Southeast Sports Seminars, and I'm also an instructor for FAKTR, and that's why we're here talking today. I have two very special new instructors to FAKTR that are going to be rolling out a brand new course here very shortly, our new FAKTR Peripheral Nerve Entrapment program. So what I would like to do is introduce all of you to our two new instructors, Dr. Mike Olson and Dr. Spencer Lindholm. So Dr. Olson, I would like for you to take a moment, just kind of introduce yourself and tell people who you are.
Yeah, thanks, Todd. As Todd mentioned, Dr. Mike Olson. I currently practicing in a hospital up in northern Minnesota. I'm a 2011 Palmer College of Chiropractic grad from the Davenport location. And after graduation, I was hired and brought up to this hospital to basically start its first chiropractic department within the confines of the hospital. They had kind of been searching for the right fit, right chiropractor for many years, and through the interview process, they decided to bring me on. In regards to my practice up here, I've been in here almost 9 years now, and I have a pretty diverse practice. Big Fork is a very small area, so I'm treating anywhere from infants all the way up to the elderly geriatrics. But I do have a more of a special interest in the sports side of the sports aspect, and as well as the rehabilitative standpoint, without overstepping my rehabilitative boundaries with the physical therapist here. So in regards to the new course that we've put together, really the peripheral nerve entrapment kind of fits in to a lot of the conditions I treat at this hospital level as well.
Very cool. So Dr. Lindholm, tell us a little about yourself.
Yeah, hi. So I'm Dr. Spencer Lindholm. I practice out in Denver, Colorado currently. So I've been out of practice for about 4 years now. I graduated from Palmer College of Chiropractic, same as Dr. Olson. And I actually did my final residency with Dr. Olson up at Big Fork Valley Hospital. So Mike and I had spent about 4 months together. Originally, I learned a lot from him because he has a very diverse practice as far as the types of patients he sees. And working in a multidisciplinary area, which I love that side of it. But right now I run a more of a sports injury based practice. So I work primarily with athletes, but, just a lot of healthy, active individuals, people that don't want to be in pain because they want to be moving and they want to be functioning, as optimally as possible. I see a lot of peripheral nerve entrapments in my practice, especially with the athletic population, as we get a lot more of the compression type peripheral nerve entrapments, as well as some traction based ones. And I've worked with a lot of the Broncos for a couple of years. Now I work primarily with a lot of CrossFitters and weightlifters and strongman athletes. And it makes my practice really interesting. So I've done a lot of training as far as rehab between, the FAKTR systems and branching out into a lot of other things that I can use to treat athletic-based injuries, but also, some of those conditions that we're going to go over today that people just don't know a lot about, like peripheral nerve entrapments. And that's the stuff I kind of nerd out on because I love getting to the bottom of that. And that's, the fun part about practice is piecing together those puzzles and figuring stuff out.
So this is a fascinating topic to me. I deal also quite a bit with peripheral nerve entrapments, but it's kind of my impression, at least a little bit of my experience, that a lot of folks out there in practice may not actually know precisely what a peripheral nerve entrapment is, and really more importantly, how to treat it. So let's just start here. I would love to get you guys to talk a little bit about what it is. What are some of the symptoms of peripheral nerve entrapment, and maybe even some conditions that are involved in peripheral nerve entrapment? Because I think this is really more, important. This is a significant differential diagnosis against a lot of other common musculoskeletal injuries, like a disc bulge that creates sciatica or radiculopathy. And I think a lot of times people get confused between what a peripheral nerve entrapment is and maybe a radiculopathy. So if you guys could maybe just address that a little bit, what is a peripheral nerve entrapment? What are some of the signs and symptoms, and maybe even some popular conditions that would be called a peripheral nerve entrapment?
Yeah, you want me to kind of start, Spencer?
Yeah, go for it, Mike.
Yeah, and so I always when I explain the diagnosis to my patient, I always relate back to carpal tunnel syndrome. I think it's probably the most well-known peripheral nerve entrapment. A lot of people don't know that can be treated conservatively as well. Most of them are going to jump to, oh, I need to have a carpal tunnel release. And so as I kind of explain carpal tunnel, then I can relate it back to that nerve. But just a couple nights ago, Spencer and I were on the phone, and he reminded me of someone that we both kind of studied under. And I'll probably steal a little bit of your thunder here, Spencer. But this instructor always said, you know, if you think of a tunnel or a certain amount of space that this nerve runs through, in order for that nerve to be entrapped, either the tunnel has to get smaller or the contents going through the tunnel have to get bigger. And so, because it's really somewhere in the body that, you know, this nerve is being irritated, whether it be the nerve itself or the tissue or the muscles or the ligaments around the nerve. And you know, to me, that's really, you know, the way to explain what a peripheral nerve entrapment is.
So I think that's a good description. It doesn't necessarily just have to be the nerve itself. Maybe the nerve has become inflamed, but it's not the entire story. Sometimes the compartment or the tunnel, as you described it, where that nerve is transitioning through can also become constricted or lose space as well. So that's very similar to the way that I try to describe it to both patients, but also other practitioners. So, hey, Dr. Lindholm, tell us a little bit about some of the symptoms we might see with this.
Yeah, so the symptoms really are based on, you know, is this motor nerve, a sensory nerve, or is it carrying both of those? And so in our course, we try and help you differentiate a lot of that, especially in the upper extremity, where sometimes we'll see motor symptoms only. So you're getting, you know, weakness, you know, decreased grip strength. And then you could be getting sensory, where you're getting a lot of pain, numbness, tingling, burning, you know, inability to discriminate touch. And then, you know, we can look at things like, are you having decreased reflexes, you know, that's coming from more of a radiculopathy, or how do we differentiate that with a peripheral nerve entrapment, where the symptoms are going to be a little more specific to the course of that nerve, because that nerve is going to innervate certain tissues, whether it be for helping muscles move or if it's, you know, to provide sensory to that area. And so those are usually the symptoms that we see, is a lot of pain, might be provoked with certain movements. You know, if we got, you know, compression underneath the pronator teres the median nerve, when we pronate, are we getting, you know, numbness and tingling throughout the distribution of the median nerve, whereas when it's at rest, we're not. So those are some of the signs and symptoms that we really look for with this.
So you brought up some good points there, that there are a variety of different ones. There's motor, there's sensory, but so what kind of conditions, because there are a lot of named conditions that we can attribute to peripheral nerve entrapments. In this course, what kind of conditions will you guys be covering that would be associated with the entrapment of a peripheral nerve?
Yeah, we try and go through pretty much everything we could think of under the sun. Whether, you know, we've got a lot of things in there that do have a heavy research basis. We know that these entrapments happen. They've researched it heavily. And then we've got some of the ones that we tend to see in clinical practice that maybe they don't have all the research behind it. But if you think logically about how the body works and where that nerve course is it can become entrapped there. And so, you know, we start from the hand and work our way up to the neck. And like Mike said, carpal tunnel syndrome is probably the most obvious, but we could get carpal tunnel of Guillen's, we could get pronator teres syndrome, you know, going up through the shoulder and the neck, as we can get entrapment of the brachial plexus by the scalenes. And we find that there's, you know, dozens in the upper extremity, and then in the lower extremity a little bit less, but really specific ones. And, you know, piriformis syndrome would be your most obvious one. You can get tarsal tunnel syndrome down in the ankle, just like carpal tunnel syndrome in the wrist. And some are fairly obvious and a little easier to treat, and some are a little bit more complex to diagnose and a little bit more difficult to treat. But we try and help differentiate that and get people at the bottom of either way.
Okay. So, Dr. Olson, so you and I have known each other for quite a while now, worked together a bit in FAKTR. You came to me a little while ago and really had a great idea about how to treat peripheral nerve entrapments using the FAKTR protocol. So what I wanted to do is have both of you kind of, do a little bit of a deep dive into, you know, first of all, what FAKTR is, and then how we use the FAKTR concepts to treat peripheral nerve entrapment. So what I want to do is basically kind of give just a brief overview of what FAKTR is, and then we'll jump into a little bit about how your course is going to use the protocols in order to treat those entrapments. So many people watching this may have at least taken a FAKTR course or heard about it. And one of the primary tenets of FAKTR is that you can treat someone in a position of provocation, which means if they are experiencing knee pain, for instance, during squatting, then we would attempt to treat them safely while they're squatting. And that treatment could involve instrumentation. It could use hands-on. It could use floss cups. There are a variety of different methodologies how we could treat that pain. So you guys are going to take this step further and now use the FAKTR concepts to address peripheral nerve entrapment. So, if you could just briefly kind of talk a little bit about how you're going to use the concepts in relationship to these peripheral nerve entrapments. So Dr. Olson, if you could take that from me.
Yeah, this is honestly, it's been a course I've been wanting to develop probably for the last 5 or 6 years. And I've kind of talked about it, and, opportunities never kind of really fully came about. And then, it's finally that day I really kind of just reached out to you and wanted to get more involved with FAKTR and did bring this up. There several reasons. There's a lot of there's a few. I don't think there is a lot of continuing education out there, whether it be for chiropractors or physical therapists or athletic trainers, on how to almost all inclusively work with peripheral nerve entrapments. There's a company where it might just be a little bit of manual therapy, on how to release the nerve or the entrapment, or maybe a little bit more about the anatomy and physiology of a nerve entrapment, but nothing there's not a course out there that I'm aware of that takes you kind of from start to finish with these entrapments. And that's really, when I thought about it, it's like it wouldn't be that difficult of a class to develop, with the potential benefits that clinicians can gain from this class being exponentially higher. And so that was really my drive to put this together, as something that, okay, with the FAKTR, the various treatments we use, whether it be from instrument assisted to decompression cupping to, nerve flossing to compression flossing, but the nice thing about FAKTR is they also, we also have that rehabilitative standpoint in there. It's like, okay, so you can come into my office, but ultimately, we still want to equip you with the knowledge and the tools to help patients continue to resolve this condition on their own at home, which is ultimately where my practice philosophy lines up with as well. So I thought this course was a perfect fit for the FAKTR because, FAKTR, again, it's not Todd, you say this all the time, it's not a treatment technique course. It's a concept course. It's a
system, really. It's a system. Yeah.
Yeah, exactly. And so we can use all of these FAKTR systems. If we get into, brachial plexus compression or an entrapment, say by these scalings, I can use these FAKTR protocols, one as a clinician to treat my patient and try to provoke those symptoms while I'm treating this. But then if I'm having the issue, I can take some of these things that we're going to educate our students on during this course to that they can use these FAKTR principles at home as well to further rehab their treatment. So I really like where this course is going to go, as they're going to learn the anatomy and physiology behind each treatment, how to help differentially diagnose them, but then also to use the treatment and some rehab at home as well.
So Dr. Lindholm, I want to kind of pull you in there for a minute and maybe just talk a little bit about what a practitioner can expect to learn in this course. So the FAKTR concepts, you guys are going to review that a little bit. So again, with FAKTR, it's not a technique course. It's a thought process about treatment where we treat statically, then we treat with motion, and then we treat with resistance and so on. So give us a little bit of a thought process behind what kinds of things you guys are going to cover in a course so that somebody can really get excited about this. Because I knowing the course already and knowing you guys, I know you guys are going to really bring a solid course, but give our listeners and people that are interested in this something to be really excited about. Tell us what we're going to go over in the class.
Yeah. Mike and I were both just really excited to start this course because we both see so many peripheral nerve entrapments. And I think early on in practice, we probably both didn't realize that there were peripheral nerve entrapments. And then we've taken so much continuing education where we feel like these topics might get touched on. You might get a little bit of it, but like Mike was saying, there just wasn't this all-inclusive course. And after both having gone through FAKTR with you, I think we both realized that we were using FAKTR principles to be treating these already. So why not turn this into a system, provide this course, and help people get to the bottom of that? So with the course, we do have a bit of an expectation that you show up, you know a little bit about the FAKTR principles. Hopefully you've taken a course already. And we expect you to know how to already go through diagnosis, physical examination. We'll review some of that stuff, but the goal of the course is to really go over a lot of the anatomy that gets forgotten, which is kind of the boring stuff. Everybody forgets it, but you have to know your anatomy if you're going to treat peripheral nerves. You have to know where that nerve is coursing. You have to know what's lying over it, what's beneath it, and what structures can compress that nerve, where you can get scar tissue between fiber osseous tunnel that entraps that nerve if you're getting a traction injury to that nerve. And so those are a lot of things we'll go over where, hey, this nerve, we tend to see that it's more compression based. And with that, it's a motor nerve only. So you're going to notice only these symptoms. This is how you can, treat it with instrument assisted using FAKTR protocols. This is how you can do some manual compression or some flossing to help free that nerve up throughout its course. And then, like Mike said, getting into some of those rehab principles of, all right, we've had nerve impingement here, of this nerve for several weeks, months, and now there's some resultant weakness, or maybe we have some sensory that we're still waiting to come back, even though we freed that nerve up. And can we, give you some rehab exercises to get strength back into that muscle, or just to return, full function? Because it's not always that obvious that you're missing strength. That maybe it's a very specific task, and that's how we use FAKTR to treat it. If you've got carpal tunnel syndrome while typing, can you have your patient reproduce that while you're performing instrument assisted FAKTR? But yeah, we try to get into a lot of the various nerves, and there's a lot of them. So I would say it's pretty content heavy. We're gonna go through so much anatomy that you're gonna kind of have a headache by the end of the weekend, but a lot of it is stuff you need to know, and that's where we hope that people review that before they come in and take the course. And then having a little bit of that rehab background. If you don't, you're still going to learn a lot when you take the course. It's not that you need to come in fully prepared, but we expect that you have a little bit of knowledge because of how content heavy this course is.
And to me, that's always been one of the value propositions about FAKTR is we bring so much to the table in one course. Like you said, a lot of folks leave just kind of brain dead at the end of a course with us because we bring so much to the table. And in this course, that's not going to be any different. So you're going to be covering a ton of assessment. You're going to be covering a ton of anatomy. You're going to be covering a ton of treatment. And that's going to be, both passive treatment, active treatment, and then there'll be some components of rehabilitative exercise too. So if somebody has already taken a FAKTR course, while it will be reminiscent of that course, you guys have really taken a significant approach to making this one different, in that you're going to be covering something that I personally think a lot of people miss in practice from a diagnostic standpoint. As I mentioned earlier, these compression syndromes, these nerve entrapments can look a lot like other very popular musculoskeletal conditions. So I'm really excited for this to get out there, because I think it's really going to elevate the understanding for a lot of practitioners out there, about the differential diagnosis between these nerve entrapment syndromes and some of the more popular stuff that I think is oftentimes misdiagnosed. So all that being said, I'm curious, who do you guys think this course would be really ideally suited for? Obviously, we're chiropractors, but there are a lot of people out there that may benefit from taking this course. Who do you guys think that is?
I'm going to throw in a little pitch for the chiropractic students about to take Part 3 boards. I mean, the Part 3 boards is full of peripheral nerve entrapments, and this is going to be a heck of a learning experience for them. And for sure, chiropractors, especially those ones that are set in stone where everything's a spinal radiculopathy, and that's not the case. And but this is a good educational class for physical therapists for sure. I think from from the top two chiropractors and physical therapists, athletic trainers as well, even just the assessment or the diagnosing and helping athletic trainers get their athletes to someone that can help treat this if they're not comfortable treating it. I think would be probably the top three that I could think of. You know, maybe medical doctors that are really involved in, like, you know, sports care or outpatient orthopedics clinics.
I can really see this being beneficial to, like you said, to chiros, PTs, ATs, perhaps even massage therapists, if that is something that is within their scope of practice. I could see osteopaths, medical doctors. What I'm really excited about here, obviously with the big epidemic of the overuse of opioids, I think this is really a good opportunity for conservative management of something that doesn't necessarily require drugs or surgery. And I'm glad you mentioned there, this is going to be really good for the students that are in those professions as well, whether you're an AT student, a PT student, a chiro student. So I think what I'm most excited about here, the wide range of professions that can tap into this conservative management of something that oftentimes ends up in surgery or drugs. So I think that's a really exciting prospect here. So I think that pretty much sums up what we were trying to talk about. Gentlemen, any final thoughts about the class? Anything you really want people to know about?
I think right now we're both just really excited to get this going. You know, anybody that is doing any type of assessment, diagnosis, treatment that is seeing, you know, patients or doing therapy, like you said, even massage therapists, is you're going to come across this stuff. And so we're excited to get the information out there. I think it'll be a great course, and hopefully everybody that, you know, is thinking about taking it takes that leap and joins us and really enjoys it as well.
Any final thoughts, Dr. Olson?
No, that was great. It's been a long haul trying to get this course together and stuff, but I mean, really rewarding too, and even just putting it together, great review. And I think sometimes, you know, the more you treat this, you start to think, it's like, holy cow, you know, I do treat this every single day on, you know, a multitude of patients. It's not, you know, one peripheral nerve entrapment coming through your office a day. It's, you know, many. And I think it can and really expand the demographics or the conditions that, you know, that anyone that takes this course is going to be able to treat. It just opens
I couldn't agree more. I couldn't agree more with you. Like the number of times early on in my career that I missed what apparently ended up being a peripheral nerve entrapment that I called something else. I think that's a very good thought process. So gentlemen, I thank you for your time. I'm looking forward to working with you guys out on the road, getting this class out there, and thanks again.